Cardiovascular diseases have become the number one killer diseases around the world. Heart attack, the technical term myocardial infarction, is a leading cardiovascular disease in adults. The moment we say patient has a heart attack, everybody would like to know what is the reason for heart attack. Heart attack is due to block in the blood vessels supplying the heart. Like any other organ in the body, heart also requires blood supply. Heart has blood vessels called coronary arteries which supplies the heart muscles with blood. When there is a blockage in the blood supply to the heart in the coronary vessels, the heart muscle suffers lack of blood supply and that condition leads to heart attack. The patient comes to emergency department with chest pain. The moment we say patient has some heart problem, they would like to know what is the reason, what exactly has caused the heart attack. So we cannot simply pinpoint one single reason for heart attack. As in typhoid or malaria, we can say single organism responsible for heart attack. But in heart attack, we have certain factors, presence of which makes one prone to develop the blocks in the blood vessels. There are certain factors called risk factors like blood pressure, high blood pressure, diabetes, high cholesterol, lack of physical activity, overweight, smoking, and excess cholesterol. Everything is a risk factor. So these risk factors makes one prone to develop blocks in the blood vessels supplying the heart, which leads to heart attack. The symptoms of heart attack, how the patient presents when the patient develops a heart attack. The most common is the chest pain, but not all chest pain might be due to heart attack. The pain due to heart attack can have a specific characters, like it may not exactly be felt as a pain at all. It might be a pressure, squeezing sensation, heaviness over the center of the chest, and that might be pain might be felt over the throat, and there can be pain in the left arm and left shoulder with profuse sweating. Patient might feel breathless, and some patients might even lose consciousness and they might feel giddy. So these are the symptoms. Sometimes the patient can have pain just in the upper abdomen alone or pain in the lower jaw alone. These are some exceptions, but it can still be a manifestation of heart attack. Sometimes the patient comes with just pricking pain over the chest unrelated to exertion, with excess belching, vomiting, that can point to some other reason for chest pain, not exactly a heart attack. How we can prevent a heart attack, a heart problem from occurring? First thing is the lifestyle modification. We have to change the way we live. We have to change our dietary pattern. We have to restrict salt, fatty food. We have to take plenty of greens, vegetables, fresh fruits, pulses, grams, and ghee, vanaspati is to be totally avoided. We have to limit coconut intake also. Non-veg is to be restricted. We can take plenty of fish. See, fish is good for heart. We can take plenty of fish. Chicken once a week, limited quantity, and egg and mutton occasionally, not very often. And we can take nuts like almond and walnut, and fatty food is to be restricted. And second comes exercise. First is the diet, and second comes exercise. Regular exercise is definitely good for heart. 30 minutes of walking, brisk walking for 30 minutes every day, at least for 5 days a week is must. So that can condition the heart, that can prevent the excess cholesterol, blood pressure and sugar. So first diet, second exercise, and third comes the risk factor modification. If one has high blood pressure, sugar, cholesterol, that has to be brought under control by diet control and drugs. A person gets a heart attack. So life is not going to end there. Still, a patient can lead a useful life, a healthy life. It is possible. So one has to strictly adhere to diet control, regular exercise. They have to take prescribed medications, and medication should not be skipped. And any chest pain should not be neglected. If any chest pain is to be consulted, and a physician has to take an ECG and decide whether it is cardiac or non-cardiac origin. If it is non-cardiac, no need to worry. If it is cardiac, patient has to take appropriate medications. So even after heart attack, a patient can lead a normal life. It is possible to lead a normal life even after getting a heart problem. It is possible. So nowadays we do angiograms. Angiograms, we just insert a catheter into the blood vessel. The catheter reaches up to the heart. We inject dye and see the coronary anatomy that shows the blockages, extent of blockages, number of blockages present in the coronary arteries, and depending upon the anatomy of the coronary vessels, if it is suitable, we can do a angioplasty with stenting and remove the blockage, or if the blockages are multiple, patient might have to undergo coronary artery bypass graft surgery. So even after surgery or stenting, patient is still possible to lead a normal life, and patient has to follow diet, exercise and drugs meticulously. Who can get a heart attack? Almost any adult over the age of 20 with risk factors, it is possible to develop heart attack. Don't neglect any symptoms as I suggested which can indicate a heart problem. So any chest pain is to be evaluated. Nowadays we get patients with heart attack younger and younger, even late 20s and early 30s we see number of patients presenting with acute heart problem. So even in the younger age, if the patient has got risk factors and chest pain, it should not be neglected. So there is a concept that women are less prone to develop heart attack. Though women are protected by their hormones, we do see number of women in their young age, menstruating females, getting heart attack. Stress might be one of the reason, and diabetes might be other reasons. Stress, diabetes can take away the protection offered to women because of their hormonal status. So women, they are also prone, equally prone as men to develop heart attack, and symptoms should not be, they should not neglect the symptoms. They should consult the doctor immediately to confirm whether it is due to cardiac problem. A patient gets heart attack, so what he has to do? The life is not going to end there. Still, they can lead a healthy life even after getting a heart attack. So the patient has to follow strict diet restrictions. They have to avoid salt, high fat food. They have to avoid snacks. They can take plenty of greens, vegetables, pulses, grams, fresh fruits. These are good for heart. They can take heart healthy diet. They have to go for regular exercise. 30 minutes of brisk walking every day, at least for 5 days a week. That conditions the heart, that trains the heart, that induces collateral formation in the heart, and that is good for heart. So diet, exercise and drugs. If the patient adheres to these three things meticulously, they can still be healthy even after getting a heart attack, and they can lead a highly active life, as I have been telling. So one has to be very, very vigilant to prevent any cardiac problem from happening. They should follow healthy lifestyle, starting from diet, exercise, quit smoking, avoid smoking, and even if they have risk factors, the risk factor has to be brought under control with diet, exercise and drugs, and they should follow cardiac drugs, and they should go for regular periodical checkup, and they can still wish to lead a normal life. So they should not panic just because they had a heart attack. So they should strive their maximum to lead a normal life. It is still possible. With a heart healthy lifestyle, one can lead a healthy life even after a heart attack. So one may tend to ask, is heart attack is the only cardiac problem which affects us? It's not so. Though heart attack has become the major cardiovascular problem, we have other reasons where the heart can get affected, like we say congenital heart disease, the birth defects. Birth defects can occur at the time of birth, or there can be acquired heart disease which develops later in life other than heart attack, like a rheumatic valvular heart disease and the myocarditis and pericardial disease. These are the other heart diseases other than heart attack. An apparently healthy person might come with chest pain and diagnosed as heart attack. They can just deteriorate very rapidly, leading to death. That is also possible. It may be difficult to convince the people. Why? Yes, apparently healthy person, all right today morning and just collapse in the evening. That is possible. Heart attack, we said block in the blood vessels supplying the heart. So block has got two components. One is the cholesterol deposition, tissue growth which occurs over years, and other one is the any breach in the outer layer, inner layer of the heart can lead to blood clotting. Blood clotting happens suddenly. Though the tissue growth and cholesterol deposition occurs gradually over years, the blood clotting occurs suddenly, and that leads to heart attack. So a person apparently healthy can develop heart attack suddenly, and that can lead to mortality rapidly.